Hello everyone. Oh, you are good, fine, fit and healthy. I am back with the new video. Today I am telling about the human respiratory system. The respiratory system is the network of organs and tissues that help you breathe. It includes your airways, lungs and blood vessels. The muscle that power your lungs are also part of the respiratory system. These parts work together to move oxygen throughout the body and clean out the waste gases like carbon dioxide. The respiratory system has a many functions. Beside helping you inhale, breathe in and exhale, that is breathe out. The first function is allow you to talk and to smell. The second function is warm air to match your body temperature and moisture it to the humidity level your body needs. Third function is deliver the oxygen to the cells in your body. Fourth function is remove waste gases including carbon dioxide from the body when you exhale out. Then next function is protect your airways from the harmful substances and the irritation. Then next, the respiratory system has many different parts that work together to help you breathe and breathe out. Each group of parts has many separate components. Your airways deliver air to your lungs. Your airways are a complicated system that includes your mouth and nose. Openings that pull air from outside your body into your respiratory system. Then next, sinuses. It is a hollow areas between the bones in your head that help to regulate the temperature and humidity of the air when you inhale. Then next part is throat, that is also called pharynx, tube that delivers air from your mouth and nose to the windpipe, that is called trachea. Trachea is a passage connecting your throat and the lungs. Then next part is bronchial tubes. Tubes at the bottom of your windpipe that connected into each lungs. The next is lungs. Lungs is a two organs that remove oxygen from the air and pass into your blood. From your lungs, your bloodstream delivers oxygen to your organs and the other tissues. Muscle and bones are help move the air you inhale and out of your lungs. Some of the bones and muscle in the respiratory system include your diaphragm, ribs. First, diaphragm muscle that helps your lungs pull in air and push it out. Then next is ribs. Ribs are the bones that surround and protect your lungs and the heart. When you breathe out, your blood carries carbon dioxide and other waste out of the body. Other components that work with the lungs and blood vessels include, that is alveoli, tiny air sacs in the lungs where the exchange of gases and carbon dioxide takes places. Then next is bronchioles, small branches of the bronchial tubes that lead to the alveoli. Then next is capillaries. Capillaries are the blood vessels in the alveoli walls that move oxygen and carbon dioxide. Then next is lung lobes. Lung lobes are the section of the lungs. There are 3 lobes in the right lung and 2 in the left lung. For in second lobe there is only 2 part because there is a place for the heart. Then next is pleura. Pleura is the thin sac that surround each lung lobe and separate your lung from the chest wall. Some of the other components of our respiratory system includes cilia. Cilia is a tiny hairs that move in a wave-like motion to filter the dust and other irritation out of your airways. Then next is epiglottis. Epiglottis are the tissue flap at the entrance to the trachea that closes when you swallow to keep food and liquids out of your airways. The next part is voice box. Voice box is also called larynx. Larynx is a hollow organ that allows you to talk and make sounds when air move and out. Okay, then next we will discuss about the common disease of the respiratory system. In that, first one is asthma. Asthma, in the case of asthma, your airways become narrow and make too much mucus formation. Then next disease related to the respiratory system is the bronchitis. In that case, inflammation and infection make your bronchial walls becomes the thicker. Then next disease is COPD, that also called chronic obstructive pulmonary disease. In that case, this long-term condition get worse over time. It includes bronchitis and emphysema. The next disease is pneumonia. An infection causes inflammation in your alveoli. They might fill up with fluid or pus. Then next disease is tuberculosis. Tuberculosis is a cause due to the bacteria. A bacterium causes this dangerous infection. It usually affects your lungs but might also involve your kidney, spine as well as your brain. Lung cancer. In that case, cells in your lungs change and grow into a tumor. This often happens because of smoking or other chemicals you breathe in. The next disease is cystic fibrosis. In that case, this disease is caused due to the problem in your genes and get worse over time. It causes lung infection that don't go away. It also called as chronic disease. Then next disease is pleural effusion. Too much fluid builds up between the tissue and line of your heart and chest. The next disease is idiopathic pulmonary fibrosis. In this disease, your lung tissue becomes scarred and can't work the way it should. The next disease is sarcoidosis. In that case, tiny clumps of inflammatory cells called granulosum form and then often in your lungs and lymph nodes. That's why the respiratory problems can be happen. That's all about the respiratory system. Thank you.